Priority questions test your ability to think critically and make the best nursing decision in real-life situations. These questions often use words like first, best, most important, initial action, highest priority. When you see these, your job is to determine what is the most critical action for patient safety and positive outcomes. If you're ever stuck, always start with the ABCs. A. Airway. Is the patient's airway clear? Stridor, choking, blocked airway. B. Breathing. Is the patient having difficulty breathing? Respiratory distress, low O2. C. Circulation. Is there a problem with blood flow? Shock, severe bleeding, low BP? Question. A nurse is caring for a 65-year-old patient who just had surgery. Which patient should the nurse see first? A. A patient with a low urine output of 30 ml in 2 hours. B. A patient with respirations of 8 per minute and difficulty waking up. C. A patient requesting pain medication for post-op pain. D. A patient with a low-grade fever of 100.3 degrees Fahrenheit. Correct answer B. This patient has impaired breathing, respirations of 8 per minute, and is at risk for respiratory failure. Remember, airway and breathing come first. If ABCs don't apply, use Maslow's hierarchy of needs to prioritize care. Order of priority: physiological needs, food, water, air, pain, temperature, elimination, safety and security, fall risk, infection control, suicide risk, love and belonging, support system, social interaction, self-esteem, confidence, coping with illness, self-actualization, personal growth, healing process. Example. Question. A nurse is assessing 4 patients. Who should be seen first? A. A patient feeling anxious about discharge after surgery. B. A patient with a low potassium level of 2.8 mEq. C. A patient who needs help choosing a meal plan for diabetes. D. A patient who wants to talk about their new cancer diagnosis. Correct answer B. A potassium level of 2.8 is critical and can lead to cardiac arrhythmias. This is a physiological need, which takes priority over emotional or psychosocial needs. When choosing a priority patient, always see the acute patient first. Chronic conditions are managed over time, but acute changes require immediate action. Question. Which patient should the nurse assess first? A. A patient with chronic heart failure reporting mild ankle swelling. B. A patient with COPD who is short of breath despite using oxygen. C. A patient with diabetes who has a fasting blood sugar of 140 milligrams per deciliter. D. A patient with rheumatoid arthritis requesting pain medication. The correct answer is B. This COPD patient is having acute respiratory distress, which is a higher priority than chronic swelling or mild hyperglycemia. The NCLEX loves to test your knowledge of patient safety. If a question asks about preventing harm, look for infection prevention, such as hand hygiene, PPE, and sterile technique. Fall prevention, like bed alarms, call lights, and assistive devices. And medication safety, such as double-checking high-risk meds and verifying orders. For example, a nurse is providing care for multiple patients. Who is at the highest risk for infection? Is it A, a patient on steroids for asthma? B, a patient with a white blood cell count of 2,000? C, a patient with a resolved urinary tract infection? D, a patient who just finished their antibiotics for pneumonia? The correct answer is B. A white blood cell count of 2,000 indicates neutropenia, meaning this patient has severely low immunity and is at high risk for infection. If a priority question gives you multiple actions, follow the nursing process, which is ADPI. Assess first, meaning gather data. Diagnose, which means identify the problem. Plan, where you determine interventions. Implement, meaning take action. And evaluate to check if it worked. For example, a patient with pneumonia has an oxygen saturation of 88%. What should the nurse do first? Should they A. Apply oxygen at 2 liters via nasal cannula? B. Call the provider for new orders? C. Document the findings in the chart? D. Check when the patient last received antibiotics? The correct answer is A. Always assess first, but if you already have enough information, the next step is to act on the most urgent intervention. Before we wrap up, here are my top NCLEX priority question hacks. First, think ABCs, which stands for airway, breathing, circulation. If there are no ABCs, use Maslow's hierarchy, prioritizing physiological needs before emotional ones. Acute patients are more urgent than chronic patients, so new or worsening symptoms are urgent. Look for immediate safety concerns like fall risk, infection, and medications. And follow ADPI. If you don't have enough info, Always assess first. Want more NCLEX test-taking tips? Like and subscribe for weekly nursing study guides. Good luck, future RNs. You've got this.